Hello. So sorry for the delay. I'm gonna try to, excuse me, I'm gonna try to make this video kind of short because, I don't know if it's because of the length of my videos lately that, they haven't been uploading right. Well, not right, they haven't been uploading. So, I'm gonna try to make this short. But today I just wanted to talk to y'all. I am in my 29th week of my pregnancy, so I am in my third trimester, and I cannot believe that he's gonna be here in 2 months. It's so real. It's so real to me right now. Like, yeah, it's real. So, without further ado, I'm just go ahead and get right on into it. I wrote some notes down, so that's why I'm gonna just be looking back and forth, trying to make that eye contact instead of like, yeah, looking here and looking like here. Like, so I'm gonna try to remember that. But okay. So, just because you guys have not heard from us, around week 27 and week 28, like some of my symptoms were like congestion and just like, yeah, like a lot of different things going on. I started experiencing like some back pain, and just from the beginning of my pregnancy I felt just heavy weight like right above my bladder. Yeah, pretty much. Like there's no other way to describe that. So around that time I had went ahead, I got a maternity belt, and I can say they are fairly inexpensive, but you might want to check with your insurance to see if they will cover it. And then the price also range and differs per like manufacturer or brand that you want to get. And then yeah, so just try to check with the insurance first to see if you can get a prescription for it. And then if not, then I mean, like they have some, like I seen on Walmart.com, like around $12. I see one like on Amazon that was similar to the one that I got. And I'm gonna get that in a moment here. Yeah, one off of Amazon, I think it was like $4. So I'm gonna go ahead and just stand up and show y'all my stomach, my 29-week old stomach or whatever. So this is us, and this is third trimester stomach, non-existent, but just all belly. So I'm gonna show y'all the belt, the maternity belt. So, sorry for the appearance of it, but I'll just show you first. So first thing first is, and it's a lot of Velcro going on, but first thing first is where it wraps around the belly. So it's gonna go like this. And I like to kind of hike it up, like kind of scoop it up when I do mine. And then I'll wrap the Velcro around this way to where I feel it's most comfortable. For the belly, and I mean, you could just wear it like this. Like, it gives some support like this, but I really like to use the back part. The next part is the back. So I try to use this like differently, but I think it goes like this. What really kind of annoys me about this one is that it doesn't have like a top or bottom situation going on. So I think the lower, where it kind of goes into like a triangle, I think that goes on the bottom part of the back. But you just want to take it, kind of estimate you know, where you think it might be most comfortable. And also to keep in mind, like, you don't want the Velcro, you don't want that top part to stick up like that. So I take this, I put it across my back, and you see like how that fits. So yeah, I think I've been putting it on right. And then I take this and I stretch this over here, and bam. Now this top strap is gonna be like, if you want to wear it under the clothes, it's gonna be to secure it at the very top, so that way it's not moving and slipping. But you see, like, I look secure, like locked down, like he's locked down in here, like he's not. No, we're not doing all of that. Like he's on lockdown. So yeah, it's pretty stuffy in here. I'm gonna leave this on just because it feels good right now. So I've been experiencing some back pain, and it's not the most pleasurable thing, of course. And then I previous to me me getting pregnant, a few years back, I had hurt my back. I injured myself really, really bad, and I got a herniated disc and sciatica. So ever since, that's just like a chronic issue. And it's pretty much like, for me, it's like when the synovial fluid kind of leaks out of the joint system from my spinal cord, it radiates. Well, not for me. That's what sciatica is. It radiates down to the knees, sometimes even to the ankles. So yeah, that's just the hardship of that. And I hate it. I hate it so much because it's like it's no pain like it. Like, what I could explain, what I could compare to it would be like like period cramps all through your body. So yeah, that's real. So besides for the back pain, other symptoms I've been feeling is like a decrease in appetite, and that hasn't really just been like now or lately. It's been honestly all throughout my whole pregnancy, like, and I only crave specific things, and if I can't get that, then I'm not really hungry. So it's like, it's weird. It's like he's very picky. He's very, I want to say bougie. He's acting real bougie, like real particular. And I mean, I can't get mad because that's just how I am, for real. But yeah, so it might be some of that, and I'm just trying to blame the baby. And then I've been having a hard time sleeping. Last night I had horrible, like, night sweats, pain. I feel like I cannot eat within like 3 hours before me going to sleep. Otherwise, if I do, it's like heartburn. And then also, depending on like how much I eat, which is very little, but I'm eating more often, it's like I feel all of that sitting like in my stomach, and like up in, it's just like a real nasty, horrible feeling. So I will have to sit up, and yeah, wait for the hours to go by. And yeah, it's too much to worry about when you're trying to go to sleep. Like, you're just trying to go to sleep, that's it. And then being pregnant, your body is just work, and it's like you need that rest. So if you are experiencing that, just try not to eat before like 3 hours prior to you laying down, and then try not to drink about 2 hours before you lay down too. And make sure you go to the bathroom, within those 2 hours, right before you go to sleep. Make sure you go to the bathroom. Speaking of the potty, lately I've only been going to the restroom probably about 2 or not 3, depending on like if it's the weekend and I don't follow like what I say, like about the 2 hour rule. I don't know what's going on. I cannot talk, but about the 2 hour rule, if I don't follow what I say, then like the weekend, usually I don't. I will get up and I'll probably go to the bathroom about 3 times. But typically, on average, it's about 1 time. 1 to 2 times maybe, but no more than that, honestly. Like, and it's really like literally I wake up naturally anyways in that period, then I'm like, oh, okay, let me just go ahead and go to the restroom. So it's like boom. And then like right before I feel like I'm about to get comfortable and settle back down, I will go to the bathroom again. So with my tricky like sleep pattern, I just try to adjust and, figure things out while I'm in it, pretty much, I guess, to say. Um, but with that being said, lately it feels like the baby has been like gripping my bladder, and like I've been having these sharp pains, and they call it, I guess, lightning crotch. But yeah, I've been feeling that, and it feels like he'll just take it, squeeze it, release, squeeze, release. Like that's literally what it feels like he's been doing. So, excuse me. Tired, and it's not even the baby's fault. I can't blame that. It's his daddy's fault because he, not to get sidetracked, but he wasn't feeling good, so he's holding on to my head while he's sleeping, and he's snoring in my ear, and then he's trying to wrap me up in the blanket, and I'm like, dude, like, get off of me. I wanted to wake up and just start swinging and just punching him, but I was just like, you know what? He don't feel good. He looks so peaceful after everything that he did to me. Yeah. But howsoever, just tired, and then that's what I've noticed too is my energy level from my second trimester, it is slowly like going down. And then that is also part of the reason too why it's taking me so long to upload videos, is because I'm just trying to adjust to that. But it is slowly trickling down, and I hope that it doesn't get so bad to where I'm just like, and I can't do anything, or, the worst case scenario is that I be put on like bed rest early. I don't want that to happen. Sorry if you keep seeing me look at my lips. You know how like you put lip gloss on and then you want to eat something. That's what I did, and I feel like I just got stuff all over my lips, but whatever. Since I have been feeling so sick, the last couple of times that I took my prenatal vitamins, I've been so sick to the point where I've thrown up. So I'm trying to figure out a different game plan on how to get back to taking those more religiously. But yeah, I don't know if maybe now I need to switch to like a different, manufacturer or something like that. I don't know, but no, I don't even want to talk about it no more. It's all bad. But if you are experiencing that, then try to definitely pick up more on the things that on the vitamins that you need, and that you are easily like you have deficiencies in. Like, try to pick up on those, and you do that just by like food that you eat and everything like that. Naturally, your body will just get rid of, release anything that you don't need. But yeah, just if you know that, like for me, I have like an iron deficiency, then pick up on more iron. And I didn't notice this. My prenatal vitamins, they have like really low iron in them anyways, but I didn't realize that my food cravings were like more vegetables and more calcium. I've been going crazy like for orange juice. Like, I've been really chugging it down. And then like calcium, like yogurt and milk. And then I've been craving oatmeal, and I have been eating oatmeal too, but I have been also eating spinach. And those orange juice, spinach, and oatmeal are really, really rich in iron. So, listen to your body. If you feel like that you are craving stuff, just, out of curiosity, out of, whatever, just like look it up, see like, oh, okay, what am I missing, or what do these foods have in common? So yeah. Oh, quick little story. Late week 27. This is like TMI, but I was sitting on the toilet and in my bathroom, of course, whatever. Okay, but I was sitting on the toilet and then I felt something leak down my leg. So I'm looking up like, what? I'm thinking it's like a spider or some type of insect or, a bird that spit. Like, I don't know what I thought. I was scared to death. I'm like, what is this? So, mind you, like, I am sitting on the toilet with no bra. So I look and I'm like looking around and my boob leaked. Leaked colostrum. I hope I'm saying that right. And I was so scared. But thank goodness it was, I mean, of course, when you first start the lactate or whatever, it's going to be clear. So it's just like a thin, like mucus, I believe. That's what colostrum is. But it's very, very like rich in vitamins and stuff like that. So it's like I got hit with a reality stick. Like, dang, he is about to be here soon. But I kind of got scared because I didn't know that you could experience that like in your 20s, the weeks or whatever. I didn't know that, but it's perfectly normal. What I did first was I took a bra, and it kind of got a little bad, I would say. I took a bra and then I went and no, I didn't. I thought that it would stop naturally, and it didn't. It kept going through the night. So, yeah, I came and I laid back down, and I noticed that my pillow was wet. And I like to lay on my pillows to kind of keep me propped up, so that way, like, I'm just able to breathe a lot better, and it's just more comfortable for me. But like, I like to sleep with a lot of pillows, but yeah, so I'm like, man, this is like through my shirt, like it's through, like it's on the pillow, like it's disgusting. So I took a penny liner, and I think it it might get so bad because uh I do feel like my breasts are more swollen. Like, I still can fit my regular bra size, or it's not even my regular bra size anymore because before I got pregnant I had lost the weight. And yeah, so I became a very, like, a maybe 2 band sizes smaller than what I usually wear, but I still like remain the same cup size. So I was like a 32, 34 triple D. But before, when I had the weight on me, I was like a 36, 38 triple D. So, yeah. So now I would say that I am really right along that 38 triple now. So, yeah, I just took patty liner, cut it in half, placed it right where, like, the nipples would be. And yeah, I of course put the sticky adhesive part on the bra and then the absorb, pad part. But yeah, just make sure that if you do try that, like, that's a good little hack. But of course with pads you won't have to worry about it so much because they're larger. But with the panty liners, just to make sure that it lines up with your nipples. But yeah, it definitely caught everything. And yeah, it was a relief. Another thing is, yeah, so, but colostrum is perfectly normal. Even I've read cases where people get it as early as like 25 weeks, like they leak. And then I think I read people get it all throughout their pregnancy. But a more natural feeling that I have been experiencing is like just like preparation. Like, I'm starting to like get into a different mode, a different way of thinking. And I don't know if that's just like some hormone inside of me that's just been released, but it's a good feeling. It really is. I feel like I'm just really accepting this and taking on the responsibility for, you know, the baby. So it's a good feeling. And then soon I I feel like I'm gonna get into the mode of nesting, because I walked into his room. I was just seeing like how everything is like falling into place, and yeah, like it's a really really good feeling. So yeah. And then let me see. Back to like more physical things that I've noticed is like bleeding gums still, and then I just been kind of like itchy all over the place. With that too, I've been having like dry patches, like especially right here, and then y'all notice that right there. um, Acne, it's just like hormones just doing what they do best, I guess. But yeah, it is what it is. Uh, and then and also too with the whole acne situation, I definitely before I wasn't doing this too much, but I definitely double cleanse my face. I thought that maybe just, well, it was working for me. Just washing my face twice a day will work, but now I'll double wash my face twice a day, if that makes sense. And then to just making sure I stay moisturized and all of that. Um, and then I noticed, oh, I need help with saying this word, but it's melasma. It's MELASMA. I'm doing that like when I was little. I would spell out the word for my mom to tell me what it was. But pretty much this is where like your skin becomes more pigmented. If y'all look closely. Like here, before I got pregnant, this was not as noticeable, and it definitely is now. And then like little spots, well, not so much there, but, and then if y'all see my knees are so so dark, and it's like rough right there. And that's definitely changed because I got that under control before I got pregnant, but for some reason, yeah. But it'll go back eventually. It's just when the pigment darkens for some reason. When you get pregnant, it darkens. And then I've been experiencing some restless leg syndrome, which I had an issue with that anyways due to like the low iron and with the sciatica. And yeah, congestion. Sorry about that. But yeah, right now that's really all for like as far as like the symptoms. But right now I'm really excited. Like the baby could hear my voice now. He might be in there smiling, which I feel like I'm goofy. His dad is real goofy, so I feel like he is in there smiling. He probably in there laughing. You know, he's moving around, he's active. So I'm getting really, really anxious. And I can't wait to meet him. I can't wait to experience, you know, motherhood and just taking care of him. And yeah, it's a lot. Um, but yeah, even though I'm still like fairly small for being 7 months right now, I feel like my baby might be like 4 pounds right now, maybe even 5, because he was already kind of bigger in my first trimester. So we're gonna see. I'm gonna keep you guys updated. On Friday, I'm gonna do an update of my pregnancy. That way I could just try to stay more consistent. I don't feel like I have to cram so much information in into one video, and then hopefully we'll see the look that I have with my uploads. But yeah, and then also too, that's one thing I have been wanting to talk about is constipation. Yeah, we done already discussed that, but it could literally happen like at a drop of a dime. Just try to drink as much water as you can, and try to drink try to eat fiber rich foods. And then migraines now are lasting a lot longer than what they have been. So I'm just going to try to do the best that I can with that. But also, I've been setting myself up now for childbirth classes and just trying to understand what can my insurance cover more. I'm trying to aim, honestly, for a natural birth. I've been watching videos. Yeah. And there's a lot of things that I don't agree with. The thought of a cesarean, it does make me uncomfortable. I know a lot of people that, they don't want to push a baby through. But I feel like with the type of person that I am, it kind of goes more into my lifestyle. So, I want that natural birth. With the epidural, that kind of scares me too because of my back issues anyways. But yeah, so hopefully that's the plan. And I'm just trying to educate myself as much as possible now with the childbirthing classes. And then also, if you guys have not, and y'all are like, you guys are around the same gestational, whatever, around the same amount of weeks as I am, you want to start checking up on daycares, try to get on somebody's wait list for, things like that. You definitely want to try to get, on a wait list or registered somewhere. Just try to be as proactive as you possibly can because spots do fill up and you just don't want to be stranded. If feeling so overwhelmed when the baby gets here. And so you want to be as proactive as possible. And also, I'm going to start doing kick counting. And that's pretty much when you lay down on your back and you count all the movements up to 10 for about an hour. Not to say that you have to be laying on your back for an hour or sitting down for an hour, but if you ever get that time, just go ahead and do the kick count right then and there. As you get higher into like the pregnancy, if you experience less than 10 kicks per 2 hours, then you might want to consider going to the hospital or just calling like your PCP or whoever's gonna take care of the pregnancy, your provider. Call them so they could either assure you or else let you know like, hey, if something else doesn't happen within an hour, they're coming out to the hospital. But that is all that I have for you guys. Just thank you for sticking with me through this. It's definitely an experience, but I feel like everything is coming together, and I know that pretty soon here it's about to be realer than real. It's about to be a Dundada. It's about to be all of that. So just thank you guys, and if y'all could see in my face, like, I'm tired, but still got a lot of work to do for today. But yeah, just like, comment, your due dates and how excited you are, or how you feeling right now, or what are you anxious about. And more than anything, if you have questions, definitely ask me questions. Please ask me questions. Comment. I want to interact with you guys. And yeah, so thank you, and subscribe to my channel. Bye bye.